Tuberculosis, or TB, is a bacterial infection that causes serious disease but can be cured with the correct treatment. It usually infects the lungs, but any part of the body can be infected. In healthy people, infection with TB often causes no symptoms since the person's immune system acts to wall off the bacteria. However, in people with compromised immune systems, a TB infection can be fatal, which is why TB is the leading cause of death among people living with HIV, accounting for 25% of HIV-related deaths in 2011. More than 6 million people in South Africa have the disease, and it kills more people than any other disease. The World Health Organization has listed active case finding as an effective method to decrease the global TB burden, stating that when resources are available, this method can be highly effective, particularly in high-incidence populations. The aim of our TB screening project is to provide community members with a house-to-house screening service and to increase awareness of the TB epidemic. This project was started in July 2011, and to date we have screened over 2,000 people for symptoms of TB and referred people to local clinics where necessary. You, along with an EDGE coordinator, will be dropped off at a specific area in the township. You will then go door to door and ask people 10 questions to determine if they have any symptoms of TB. When you meet people, always introduce yourself politely, state that you are an Edge of Africa volunteer, and clearly explain the purpose of the project. You will find that most people are willing to answer the questions and will even invite you into their homes and offer you a place to sit while you ask the questions. If someone answers yes to any of the questions, they need to be given a referral letter to take to the clinic. Fill out the information on a blank letter and give it to them to take to the clinic, making sure that you have filled in the information accurately. After you return from TB screening, the data for that day needs to be entered onto the office computer. It is much easier to do this every day that you screen, rather than waiting until the end of your stay to enter all the data. Each time you go out to screen, you need to bring the following items: a minimum of 1 completely blank screening sheet, at least 8 blank referral letters, a clipboard and pen, a bottle of water, and information pamphlets.